Now we're going to talk a little about my other interest, which is sports injuries, particularly of the knee. We have a number of surgeons here at Houlihan and Mount Vernon who have an interest in sports injuries. My colleague deals with the shoulder injuries, and I tend to deal with the knee injuries. Sports injuries are becoming increasingly common, largely because more of us are playing sport, which is a good thing, but the side effect of that is an increase in injuries, particularly to the knee and the shoulder. The type of injuries people can sustain are injuries to the cartilage, both the shock-absorbing meniscal cartilage as well as the joint cartilage. This is an example of a knee, and you can see here there are two types of cartilage. The cartilage that covers the ends of the bone, and then these pinker C-shaped cartilages, which are the shock absorbers, also called in the profession the meniscus. You'll have heard of many professional footballers tearing the cartilage within their knee and needing a keyhole operation, and this is the cartilage that's operated on. I see a lot of patients, particularly footballers and rugby players, who have torn their cartilages or have damaged the joint cartilage on the end of their thigh or shin bone. This type of injury often needs rehabilitation with physiotherapy, but also keyhole surgery to rectify the problem. The surgery is now always performed as a day case through 2 small incisions, and we aim to get you back on your feet, back driving within a few days, and back to playing sport within about a month. The surgery is becoming more and more successful, and we are now repairing cartilages more than in the past, rather than removing them, which was the traditional treatment. A second very common injury that I see is an injury to the ligament deep within the knee, which is the cruciate ligament. And here you can see on the model, the anterior cruciate ligament here is one of the commonly injured ligaments, and you'll have heard of many sportsmen doing this, particularly Michael Owen or Lawrence Dallaglio in the past. If you are a fit and sporty individual, it's likely that having torn this ligament you'll be unable to return to sport due to a feeling of your knee giving way underneath you. This is often associated with pain and an inability to return to any sort of activity, including just kicking a ball around in the back garden. If this is the case, each time your knee gives way underneath you, you do risk damaging the other cartilages within your knee and unfortunately precipitating some osteoarthritis when you're older. For this reason, and in order to get you back to sport, we would recommend having this ligament reconstructed. This used to be a very major operation involving a large incision over your knee and a significant period of time in hospital and a long period of time recovering from the surgery. Techniques that we've now developed mean that this surgery is now performed as a day case, so you're out of hospital the same day. It's done in a keyhole fashion with 3 small incisions over the front of your knee, and now takes between 30 and 60 minutes only. I would expect you to walk out of hospital with crutches possibly for the first week or 2, and then to begin the physiotherapy rehabilitation program, and I would expect you to be running on a treadmill by about 8 weeks following the surgery. Unfortunately, you will require 6 months away from any contact sports to allow your muscles to recover, as muscle wasting is often a significant consequence of injuring this ligament. Saying this, 90% of you will return to full activity following this surgery, and the other 10% will either decide to give up their sport due to the injury they've had, or feel unable to return, largely due to the psychological consequences of injuring this ligament. The surgery now is safe and very successful, and if you do have a knee that's giving way on you following an injury, I would suggest you seek some help from your GP and a referral to our sports clinic here at Mount Vernon or Hillingdon. Another topical conversation in the press is about cartilage transplant surgery within the knee. As I mentioned earlier in this talk, there are 2 types of cartilage. There's the cartilage that lines the end of the bone, which is the shiny white articular cartilage, and there are these C-shaped meniscal cartilages deep within the knee. We now have techniques for patients who are suitable, largely younger patients with sports injuries, that can have cartilage transplanted back into their knee to repair any damage that's done. This is often done by taking a sample of your own cartilage and sending it away for the cells to be grown, and then for those cells to be re-implanted back into your knee about 6 weeks following the first operation. There are other techniques that we use, including implanting scaffolds or plugs into the knee to allow your own cartilage to grow across the hole that's been made and to resurface the joint and to reduce your pain. These techniques are very much in their infancy and being developed year on year, but are looking very promising to replace damaged or worn cartilage. With respect to the C-shaped cartilages or the meniscus, when these are damaged beyond repair or when they have to be removed due to severe damage, this can often cause pain within the knee that previously has been impossible to cure. Now, previously we have tried to implant cadaveric or donated cartilage into the knee, but this did not prove particularly successful. We now have techniques where we can stitch artificial scaffolds into the knee to allow your cartilage to grow into this scaffold and replace the damaged area. This again is very much in its infancy, being performed in Europe, and we're beginning to start this procedure here at Hillingdon. It's looking promising in a number of ways, both to reduce your pain but also to increase the survival of your normal knee and prevent you requiring any surgery in the future. We have a full range of sports injuries, surgeons and techniques available here at Hillingdon and Mount Vernon, including cartilage transplant, ligament reconstruction, and we work very closely with our sports physiotherapists in order to get you back on the field and back to full function as quickly as possible. If you'd like to come and see us, please don't hesitate to contact us via the Hillingdon Hospital switchboard, either through my secretary or the outpatient department. I hope that's been informative to you, both in regards to arthritis, knee replacement and sports injuries. If you'd like to come and see me or want any further information, don't hesitate to contact us on the numbers we've given or an email address below. And in the nicest possible way, I do hope not to see you in clinic, but of course you know where we are if you need us. Goodbye.
Thank you, David.